This is Klahn's Clinic on benign brain tumors. In this video, you'll learn about brain anatomy and function, what a tumor is, causes, symptoms, diagnosis, treatments, and complications of a general benign brain tumor. If you don't already know, the brain is the command center of the body. It sends out, receives, and processes information via the rest of the nervous system. The brain itself is divided into three major sections. Those are the cerebrum, cerebellum, and brainstem. In short, the cerebrum is the largest section and is in charge of controlling and processing feeling, emotion, and the senses. The cerebellum is smaller than the cerebrum because it only controls movement and balance. The brainstem is the final part which connects the brain to the spinal cord, and it is in charge of some of the most important autonomous functions like heart rate and body temperature. But there is more than just brain in there. Inside the head there are also blood vessels, 12 major cranial nerves, and layers of connective tissue that surround and protect the brain called meninges. That is the very basic anatomy and physiology of what is inside of your head. Now, without further delay, let's talk about tumors. A tumor is really just a bunch of your cells that don't quite work the way that they are supposed to. They will start out as one cell and divide into many. That is because the cell's genetic information, or DNA, mutates, meaning that it changes. These changes can occur from ionizing radiation, which is the kind of radiation that you receive from radioactive elements, chemical exposure to carcinogens, or from mishaps in cell division. When a mutation occurs, the cell's instructions may change and affect its behavior. The mutated cells can ignore signals from other cells and ignore biological barriers that tell it what it should and should not do. When this happens, the cell will begin to go haywire, and it will divide itself over and over again, despite cells telling it that there is no more space to grow, and it will ignore messages telling the cell to die. Cell division that isn't regulated can lead to more mistakes in DNA, which can cause the cell to become even more out of control. Fortunately, these benign brain tumors are fairly tame, as they grow slowly, will not invade other tissues or surrounding areas of the body, and they have a defined border around them. For the most part, the body has these abnormalities locked down, but they still hang around because they are unable to be terminated. Since our entire body is made of cells, and all cells are similar in a way, these brain tumors can appear anywhere in or on the brain. Because each part of the brain is responsible for something somewhere in the body, it can produce an extremely wide range of symptoms. A patient may experience headaches from increased pressure of the surrounding tissue, nausea and vomiting, vision problems, loss of sensation or paralysis, speech difficulty, problem with hearing, confusion, seizures. Pretty much wherever your tumor is where you will feel the symptoms. And due to the wide range of symptoms, diagnosis can be difficult at first. The first step of diagnosis is a simple neurological exam. The doctor will test your senses, balance, coordination, strength, and reflexes. This and general questioning may reveal that there is something wrong with your nervous system. To see what is truly going on, diagnostic imaging tests will be ordered. MRI and CT will be able to show you where the tumor is, but these benign tumors are typically a lot smaller than their cancerous counterparts and may be difficult to pinpoint, so additional tests can be added onto both MRI and CT. A functional MRI will measure the changes in blood flow to the brain when a stimulus is shown. The stimulus will increase perfusion to that part of the brain responsible for processing of that stimulus, and thus may reveal the tumor if it is near that area. Speaking of perfusion, a perfusion MRI will use contrast dye to measure the actual blood volume. Tumors do not follow normal cell rules, so the tumor's tissue will look a lot different from the normal brain tissue. Finally, a magnetic resonance spectroscopy will be used to analyze hydrogen ions and protons. This method will be able to tell the doctor what type of tumor you have from the levels of amino acids, lipids, lactate, and other molecules that form the chemical makeup of the tumor. Moving on to the CT machine, A CT angiography will use contrast dye to view the blood vessels. It will be able to show the brain's vessel network and can reveal the tumor by an area of strange vessel structure. Next, Positron Emission Tomography uses nuclear medicine to analyze the tumor. Molecules containing radioactive isotopes enter the body intravenously, and from there, they will work their way around the body to give information about oxygen use, blood flow, and metabolism. This information, combined with the previous imaging test, will give the doctor a good idea of where, how, and what the tumor is doing. Getting more invasive, the abnormal cells themselves can be analyzed after a tissue sample is received. This sample can be done through a biopsy, which is an excision of cells through a needle or surgery. Sometimes the tumor is located deep within the brain or is near a major nerve or vessel. In this case, a stereotactic needle biopsy will be performed. The stereotactic needle is inserted through a hole in the head and is guided by MRI or CT to extract a small amount of tissue for analysis. And once that diagnosis is definite, treatment may begin. Starting with surgery, part of the skull will be removed to give the surgeon access to the brain. From there, they will try to remove the majority of the affected tissue. Another surgical option includes radiosurgery. This is not a traditional scalpel to flesh surgery. Instead, several high-energy radioactive beams are shot into the head. These beams come together at a point where the tumor is located. This method can reach tumors that surgeons can't without causing damage, and it will keep your head intact, leaving you with a short recovery time at the risk of a high radiation dose. However, this radiosurgery is not the same as radiation therapy. Radiation therapy will repeatedly use larger beams with lower doses of radiation to kill a bigger area of tumor cells over the course of some time. Or, instead of using beams, radiation therapy can take place inside the body, known as brachytherapy. Brachytherapy allows a highly concentrated amount of radiation placed near the tumor. This has similar results to the other radiation treatments. Moving on to drugs, chemotherapy is a type of targeted drug therapy and is typically used to clean up after surgery. Chemotherapy falls under two major categories: cytostatic and cytotoxic. Cytostatic medications prevent the cells from dividing further, with the goal of halting the tumor's growth by forcing the cell cycle to stop. Cytotoxic medications will stop the tumor cells from avoiding death by a number of different signals and functions within the cell. These medications are toxic to the tumor cells and will eventually kill it off. During or after your main treatments, post-treatment care begins in order to help the patient return to their previous activities. Physical therapy will help with strength and motor function. Occupational therapy helps with day-to-day tasks. Speech therapy will help any of those with a tumor affecting the speech regions in the brain. And tutoring will mostly help kids in order to help ease the child back into school and will help them with memory and other special complications from the tumors. When describing what a tumor was, I mentioned that these benign tumors are pretty tame. However, they do have a very small chance, of becoming cancer and spreading to other parts of the body. This chance increases with treatments that use radiation, as radiation is a main cause of DNA mutation. A benign tumor will not return, but from the mutations of additional radiation, other cells may mutate and become cancer as well. Although these benign tumors don't spread to other cells, they still affect surrounding tissue because they are taking up valuable space that simply isn't available. This can compress the brain against the skull and cause swelling, or it can press up on blood vessels and nerves, which end up restricting blood flow and changing the nerve signals. Tumors near the nerves, like the optical and auditory, may end up in a loss or impairment of sight and hearing respectively. Disregarding all that, a patient's outlook is pretty good for healthy adults and children with benign brain tumors. Unfortunately, that good outlook decreases greatly as we get into the elderly age range, as the treatments are really invasive and put a lot of stress on the body, both of which are not good for the aging person. In conclusion, the cooling pool is not a swimming pool. It's not meant for you to cool off on. That's all I have for benign brain tumors. If you would like to see my previous video on ulnar collateral ligament injury, that'll be down in the description. My next video will be on glaucoma. This is also my last suggested video, so if you have something that you would like to see or have explained, put the name of it in the comments and I will make a video on it. But until then, stay healthy and be safe.